Hello and welcome. Today we're delving into a relatively uncommon but important topic: ureteral tumors. These tumors arise in the ureters, the tubes that carry urine from the kidneys to the bladder. While less frequent than bladder or kidney cancer, understanding ureteral tumors is crucial for early detection and effective management. The exact causes of ureteral tumors are not fully understood, but several risk factors have been identified. The most significant is smoking. Similar to bladder cancer, tobacco use increases the risk substantially. Exposure to certain industrial chemicals, such as those used in the dye and rubber industries, is also implicated. Furthermore, a history of bladder cancer is a notable risk factor, as is Balkan endemic nephropathy, a chronic kidney disease prevalent in certain regions of southeastern Europe. Ureteral tumors typically arise from the lining of the ureter, called the urothelium. The most common type is urothelial carcinoma, also known as transitional cell carcinoma. These tumors can grow in several ways. Some are papillary, resembling finger-like projections, while others are flat and invasive. As the tumor grows, it can obstruct the flow of urine, leading to hydronephrosis, which is the swelling of the kidney due urine back up. This obstruction and direct invasion can cause local symptoms and, if left untreated, can spread to regional lymph nodes and distant organs. Ureteral tumors are relatively rare, accounting for only a small percentage of all urological cancers. They are more common in men than in women, and the incidence increases with age, typically affecting individuals between the ages of 60 and 80. Geographic variations exist, with higher rates observed in regions where smoking is prevalent or where exposure to specific industrial chemicals is more common. It's worth noting that patients with a history of bladder cancer have a higher risk of developing ureteral tumors later in life. The signs and symptoms of ureteral tumors can be subtle and easily mistaken for other conditions. The most common symptom is hematuria, or blood in the urine. This can be visible to the naked eye or only detectable under a microscope. Flank pain, which is pain in the side or back, is another frequent symptom, often caused by hydronephrosis. Some patients may also experience urinary frequency, urgency, or dysuria, painful urination. In more advanced cases, patients may present with weight loss, fatigue, or a palpable abdominal mass. Diagnosing ureteral tumors involves a combination of imaging and direct visualization. Urine cytology, where urine samples are examined for cancerous cells, may provide initial clues. Imaging techniques such as CT urograms and intravenous pyelograms (IVP) are crucial for visualizing the ureters and identifying any abnormalities. Ureteroscopy, a procedure where a thin, flexible scope is inserted into the ureter, allows for direct visualization of the tumor and allows for biopsy to be taken for pathological confirmation. Biopsy is essential to confirm the diagnosis and determine the tumor type and grade. The vast majority of ureteral tumors, around 90%, are urothelial carcinomas. These are further classified based on their grade and stage. Grade refers to the aggressiveness of the tumor cells, with low-grade tumors growing more slowly and having a lower risk of spreading. Stage refers to the extent of the tumor's spread, from confined to the ureter lining to involving deeper layers or spreading to lymph nodes and distant organs. Less common types of ureteral tumors include squamous cell carcinoma and adenocarcinoma, but these are rare. Treatment for ureteral tumors depends on several factors, including the tumor's size, location, grade, stage, and the patient's overall health. For small, low-grade tumors, endoscopic removal may be an option, involving the use of a ureteroscope to excise the tumor. However, for larger, more aggressive tumors, radical nephroureterectomy, the surgical removal of the entire kidney and ureter, along with a cuff of the bladder, is often necessary. Lymph node dissection may also be performed to assess for spread. In some cases, chemotherapy or radiation therapy may be used as adjuvant treatments, either before or after surgery, to kill any remaining cancer cells. While there's no guaranteed way to prevent ureteral tumors, several lifestyle modifications can reduce the risk. The most important is to avoid smoking. Quitting smoking significantly lowers the risk, not only of ureteral tumors but also of other cancers and cardiovascular diseases. Minimizing exposure to industrial chemicals, especially those used in the dye and rubber industries, is also advisable. For individuals with a history of bladder cancer, regular surveillance with urine cytology imaging may help detect ureteral tumors early. The prognosis for ureteral tumors varies greatly depending on the stage and grade of the tumor at the time of diagnosis, as well as the effectiveness of treatment. Early-stage, low-grade tumors have a relatively good prognosis, with high survival rates after treatment. However, advanced-stage tumors, especially those that have spread to lymph nodes or distant organs, have a poorer prognosis. Recent research focuses on improving diagnostic techniques for early detection, developing more targeted therapies, and understanding the genetic factors that contribute to ureteral tumor development. Immunotherapies and targeted agents are also showing promise in treating advanced ureteral cancers, offering hope for improved outcomes in the future.